Welcome to this moving and handling awareness training for as you would expect, there are various laws to cover moving and handling of people. The first one is the Health and Safety at Work Act. This makes sure that people can come to work and go home safely. But it also covers third parties such as service users. Then there is the Management of Safety Regs. This requires employers to carry out risk assessments. Then there is the Manual Handling Operations Regs. These demand the minimal manual handling approach, i.e. use equipment. So as a guide, the free load that a man can lift is 25 kilograms and 16 kilograms for ladies. Of course, some will be fine lifting more and some less. It depends on individual circumstances. There's another law called the Lifting Operations and Lifting Equipment Regs. This requires the equivalent of an MOT every 6 months for any equipment that lifts people. This is called the Lola check. Then there is a provision and use of work equipment regulations. These require an annual check, for example, wheelchairs or profile beds. Your organization will have local policies and procedures to cover this. Both employers and employees have legal responsibilities. The key one for individuals are look after your own health and safety and others around you. So no horseplay. Cooperate with your employer in matters of safety. Follow your training. Look after equipment and report defects. Wear any personal protective equipment that is required. When carrying out any moving and handling task, think of tile. T. Does it involve twisting, stretching, turning? I. How am I feeling today? Fit and well? Any medical conditions? Pregnancy? How is the service user feeling? L. Load. Is it clean? Contaminated? Is the center of gravity symmetrical? E. Environment. Is the floor level? Is it slippery? Is the lighting okay? Infection control has always been important when moving and handling people, but especially so during the COVID-19 crisis. So, wash hands frequently with soap and hot water or use sanitizer gel. Wear the appropriate face mask. Make sure there is a good seal around the nose. All sharp should be disposed of in the yellow bins. When cleaning body fluids, take extra care with hygiene. Change work clothes as soon as you get home. Equipment checks. Wheelchairs are good for moving people around. However, they should have a pre-use check. This is not complicated. It's just a question of looking at the armrest. Are they secure? Any damage? Is the back and the seat in good condition? Any loose stitching? Is a cushion in place if required? Is a seat belt in place if required? Have a look at the frame, any obvious signs of damage? Tyres. Is the tread in good condition? Pressure okay? Pushing handles. Are the grips secure? Foot plates. Are they in place? Never use a wheelchair without foot plates. Overall condition. Is it clean? Has it had its annual check? And what's the safe working load? Equipment checks. Hoist. Is the battery in place? Has it been charged? Test the handset. Any signs of damage or leaks? Emergency stop button. Is it set correctly? Are the casters moving freely? Are the legs moving freely? Check the spreader bars. Any sharp edges? Equipment checks. Slings. Slings have to be specific to the person. They come in different sizes and different safe working loads. This will be specified in the care plan or moving plan. Carry out a visual check. Any signs of damage, loose stitching? Check the sling hoops. Is the sling compatible with the hoist? Some require clips, some require loops. Is it clean? Team handling. When working in pairs, it's important that one person takes the lead. Be clear with instructions, e.g., ready, steady, stand, ready, steady, slide. This way, both carers know what to do, but also the service user is aware of what's going to happen. Service users are human beings and are covered in the Human Rights Act. So be sensitive when working with them. Be aware of their dignity, gender, any cultural or religious issues, and basically, even if they can't communicate by talking, you still have to ask their permission and look for body language before you move them. And also look for signs of how they're feeling today. Their health can change rapidly, so one day they may be able to stand, another day they may not. So it's important to take that into account. Thank you for watching this training program. In summary, we've covered definition of manual handling. We've covered some of the legal responsibilities, causes of back pain, how to look after your back, how to carry out a dynamic risk assessment using tile, and how to do some equipment checks. Thank you.